Preeclampsia, brought you by Savannah, Henny and Harmke. Preeclampsia is a disorder of pregnancy characterized by the onset of high blood pressure and often a significant amount of protein in the urine, which can be fatal when left untreated. Preeclampsia occurs only in women, usually after 20 weeks of pregnancy. About 3 to 5% of pregnant women suffer from preeclampsia. Women who have previously been pregnant have a lower chance of preeclampsia. Risk factors for preeclampsia are obesity, previously suffered from hypertension, older age and diabetes. There is no clear cause of preeclampsia, but is probably related to several factors. These factors include abnormal placenta development, immunological factors, nutritional patterns, environmental factors and prior pregnancy. It is thought that the fetus gives signals to the mother's body, reducing the trophoblast feed. Trophoblasts are cells forming the outer layer of a blastocyst, which provide nutrients to the embryo and develop into a large part of the placenta. This causes a change in the spiral arteries, which indirectly leads to hypertension. In preeclampsia, abnormal blood vessels form the placenta. Normally, the spiral arteries become 5 to 10 times as wide as normal to give the fetus sufficient blood supply. In preeclampsia, the blood vessels become fibrous, causing the blood vessels to become much narrower. As a consequence, the blood supply of the fetus decreases and may result in growth restraint of the fetus. Death of the fetus or the release of pro-ambulatory proteins that may enter the mother's blood. Through these pro-inflamed proteins, dysfunction of the endothelial cells of her blood vessels may occur. The dysfunction of the endothelial cells causes the blood vessels to become narrower and affect the kidney, causing the kidney to absorb more salt. All this causes hypertension. In preeclampsia, hypertension is when the blood pressure is greater than 140 mm of mercury systolic and greater than 90 mm of mercury diastolic. Severe hypertension is when the blood pressure is greater than 160 mm of mercury systolic and greater than 110 mm of mercury diastolic. Severe hypertension can lead to hemorrhage, blood vessel destruction, placental abruption, which means that the placenta leaves the uterine wall. Local vasospasm, which means a local vasoconstriction of a blood vessel, can lead to reduced blood flow to the kidneys, which can cause proteinuria, retina, blurred vision, flashing lights, scotoma, liver injury and swelling, elevation of liver enzymes. The endothelial dysfunction is the result of inflammation proteins, but there are other factors involved. It is thought that disturbance in the balance of angiogenesis and anti-angiogenesis factors also plays a role. The soluble FMS-like tyrosine kinase 1 levels are higher in women with preeclampsia. SFLT1 is an anti-angiogenesis factor that counteracts vascular endothelial growth factor and placental growth factor. This prevents the development of blood vessels. This is related to the previously mentioned spiral arteries that do not open wide enough to provide the fetus. Thrombi develops because of the damaged blood vessels. As a result, many platelets are used. Because of these accumulation, the red blood cells may cling to the large platelets. This may cause hemolysis and infarction. All this together is called the HELLP syndrome. HELLP stands for hemolysis, elevated liver enzymes, low platelet count. The HELLP syndrome is found in 10 to 20% of women with severe preeclampsia. The endothelial injury makes blood vessels more permeable. As a result of this increased permeability, more water will enter the tissue. Due to the fact that less protein is present in the blood due to the proteinuria, more water will enter the tissue through osmosis. Due to the decreased proteins in the blood in the more permeable blood vessels, edema develops. Generalized edema is limited to the feet. The first diagnosis that is made is when the woman has a high blood pressure over those more than 20 weeks pregnant. Then a urine test is performed. The protein and creatinine content is examined in urine. As protein and creatinine content is greater than 0.3 grams et mol, there is proteinuria. The creatinine content in the urine says something about the condition of the kidneys. Other diagnosis is to test thrombocytopenia, less than 100,000 per microliters, and edema in the body such as the legs and in the organs such as the liver and the lungs. Women who have suspected preeclampsia are tested by SFLT-PIGF ratio. The ratio is used to estimate how long a pregnant woman who has preeclampsia may remain pregnant. Furthermore, it indicates whether a woman is suspected of developing preeclampsia during pregnancy. This test is performed in women who are pregnant from the 24th week to the 36th week, higher than 36 weeks. The test cannot be performed because the female's SFLT-PIGF ratio is high in normal pregnancy at over 36 weeks of pregnancy. Prevention: use of aspirin for those at high risk, calcium supplementation, treatment of prior hypertension with medications, labetalol and methyl-dopa, magnesium sulfate for preventing preeclampsia in those with more severe conditions. In short, preeclampsia is a condition characterized by high blood pressure and proteinuria, associated with renal failure, vascular spasm, edema, infarction, liver dysfunction, releasing more liver enzymes. Tis was hella lotta work, so you better clap for this. Thank you very much and see you next time. Have a nice day you.